Perinatal mental health is one of the leading causes of overall and preventable maternal mortality, and it's one of the most common complications of pregnancy.
So the Massachusetts Child Psychiatry Access Program for Mom, the acronym for that is MCPAP for Moms, that was a program that was developed just about 10 years ago now, and it was really developed in response to a huge gap in care. Depression, for example, or mood anxiety disorders in general occur in 1 in 5. Depression occurs in at least 1 in 7 individuals that are pregnant or postpartum. And what we did a study, and we found that even if they screen positive for depression, less than a quarter of those individuals get even to an initial health appointment. So what MCPAP for Moms aims to do is to build the capacity of obstetric settings to provide mental health care themselves. It leverages us as psychiatrists as a limited resource by us helping the OB providers to provide that care themselves. We have a team of psychiatrists across the state who provide training, consultation, and we have a team of resource and referral specialists who really help guide and hold the hand of obstetric practices so they can provide mental health care to pregnant and postpartum individuals.
My role in the Lifeline For Moms team in addressing perinatal mental health really is to create that intersection of obstetrics and mental health care and to engage obstetric care clinicians in addressing perinatal mental health.
I felt hopeless, I felt lost, I felt alone, and I felt desperate. I couldn't envision myself feeling any differently than I did at that moment. But the moment that you realize you have a team that makes you feel worthy, it changes your whole perspective. It really does.
Perinatal anxiety disorders are the most common mental health condition in the perinatal period and may affect as many as 1 in 5 perinatal individuals. That's individuals during pregnancy or in the postpartum period, up to 1 year postpartum. We know there are really not many interventions that have been developed to prevent perinatal anxiety disorders. We are using something called the Computerized Intervention Authoring System, or CIAS. So it actually uses both SMS text messaging and it has a web-based kind of platform. It includes information about anxiety, normalizing how common it is. There's a lot of stigma in the perinatal period about experiencing anxiety or other mental health conditions. So that type of information can go out directly in the text messages. And then users could have the opportunity to click to learn more. They can watch videos.
One of the things that we're trying to do is put together infrastructure for real ongoing evaluation of these programs to really make sure that the quality of care is as high as it can be and that the services are being provided equitably in a way that ideally reduces health disparities nationwide. As researchers have to listen really, really carefully to make sure that we're understanding as best as we can what patients and clinicians and others are saying to us to make sure that our research is as informed as possible.
We've developed an implementation toolkit to really help OB providers integrate depression and anxiety care into their workflow. So it's part of the care, just like diabetes. It's screened, it's assessed, it's followed up until full recovery. And the data that we have from our program in Massachusetts is that when these programs are implemented and when OB practices are enrolled and use them, that is linked with improvement in depression outcomes and also in treatment initiation and sustainment rates.
I think the most important part of what we do is that it's not research, it's not theoretical, that we actually get it to the point of helping pregnant, postpartum, and lactating individuals, and that's what makes this work so meaningful.
Honestly, it saved my life.